I found that when I was training in ophthalmology, I really had a passion for glaucoma and cataracts. And I was, again, really fortunate to be able to come to Bascom Palmer for a glaucoma fellowship training. And that is primarily what I do, is treat patients with glaucoma and or cataracts, sometimes both. I've been very fortunate at Bascom Palmer to have wonderful colleagues to work with so that we can collaborate on sort of the intersection of different disorders in ophthalmology. And I have worked with my ocular surface disease counterparts here for many years on how glaucoma and the ocular surface interact. We know from our research that glaucoma medications can exacerbate ocular surface problems in our patients, and that oftentimes that decreases our compliance with medications and our ability to effectively treat these patients. So we have worked for years on ways that we can mitigate some of this and get our patients treated more effectively. Glaucoma surgery is primarily decreasing intraocular pressure, and we have some really effective ways and surgeries to do that. We know, though, from history that the surgeries that decrease intraocular pressure the most also have some sometimes pretty intense complications. And so minimally invasive glaucoma surgery is a method of doing glaucoma surgery to decrease eye pressure while being safer and perhaps easier for patients to undergo. We primarily do these surgeries along with cataract surgery. So again, nice segue from my interests of glaucoma and cataract. We treat the part of the eye inside called the trabecular meshwork, and we have nice access to the trabecular meshwork while we're doing cataract surgeries. So this has been a very effective and innovative way to treat our glaucoma patients. The problem with glaucoma is that it's a disease of degenerating optic nerve and optic nerve fibers. And so our challenge is to find ways other than decreasing intraocular pressure to regenerate or save dying retinal nerve fiber layer. And so there are numerous studies, including at Bascom Palmer and elsewhere, looking at how we can regenerate the dying retinal ganglion cells that are responsible for glaucoma. So Bascom Palmer is a truly unique and wonderful place to work. I have actually worked here my entire career since finishing fellowship, and the main reason for that is really the people, the interaction of my colleagues, my staff, and my patients is what I think makes Bascom Palmer truly unique.